You're watching America Trends. I'm Mary Burt-Godwin, and I have the privilege of speaking with Dr. Greg Hammer. He is a pediatric intensive care physician, professor at Stanford University of Medicine, mindfulness expert, and the author of Gain Without Pain, the Happiness Handbook for Healthcare Professionals. And just before the break, we were starting to talk about this concept of no bad days and how I don't love that concept. And I was reading, I think on your website or somewhere, this non-duality approach. And I was thinking it might be similar, that there's not like a good and a bad and you're either happy or you're not, or you're depressed or you're not. It's like this continuum, and we have to kind of walk through the things that inevitably are going to happen in life that maybe aren't great and maybe don't make us happy all the time, but it's okay, right? And we do that with things like gain and gratitude and acceptance. So I wanted to talk to you, or have you talk a little bit about this non-duality approach.
Well, non-duality is really a spiritual practice, or it really acknowledges what many consider to be a truth, that we're all made of the same stuff. That you can look at the world two ways. One is that what would be called the materialist view, which is that we're made up of all these particles, and the particles make up our tissues, our neurons, et cetera, and our neurons are like electric circuits, and all this stuff works together. We can understand it if we keep breaking it down into its component parts. And consciousness, really the love that we share, call it God, this arises from our neuronal networks and so on, and from our mind. And the opposite approach is the consciousness-only approach, which is that consciousness is primary and it manifests as all of us. And so we're all really the same stuff. And if you believe that we're all the same stuff, whether it's through non-duality or Christianity or Judaism, I think that all religious and philosophic traditions embrace the same principles at their core. And that is that we are all one, and whether you want to call that God or something else. So if you believe that, then we would treat each other as though we're all loving each other and treat each other much differently. So, but with respect to what you brought up about having a bad day and so on, I think that when the world doesn't comport with our wants and apparent needs, we tend to be unhappy, and there's pain. Mm-hmm. We've all lost loved ones. That certainly doesn't comport with our wants and needs. I lost my son at the age of 29, 6 years ago. That's certainly a painful experience. Pain is an intrinsic part of life, and we need to accept that. And unfortunately, our minds are wired, I think, through tens of thousands of years of evolution in ways that apparently veil our happiness and our ability to cope with this pain. And so the good news is that our brains have this wonderful quality called neuroplasticity. And that means, though our brains are wired in ways that may make us rather negative, that may make it difficult for us to be present where happiness lives, we can change that. We're not going to change it overnight, but if we're intentional, the I in gain, we have a purpose, a purposeful practice, we can gradually rewire our brains to be more present, more positive, and more accepting. And that is really the goal, I think.
I love that. And I love, I was seeing that things come in threes, which is you talk about 3 minutes a day of meditation. Even if, because some people think, I don't have time to meditate. And I know I was this way. I thought, it's this big thing and I got to make it a thing and I'm not going to be able to calm my brain down. But really, sometimes my brain is calm and sometimes it's not, and that's okay. But I've committed, I have a 7 minute a day Kundalini meditation that I do. But it started with 3 minutes a day because that's all I could handle. But it was something I had to intentionally work on and kind of force myself at times, right? But because then it became part of who I am through hard work. And I almost think of it as like when we practice sports, we're not good at when we first start, but we do the drills over and over again. And then all of a sudden we're like, oh, hey, we're kind of good at this. But that is something that it takes hard work. And then the other thing that was threes was, I think you wrote gratitude and writing even 3 things you're grateful for. And when somebody is maybe not in a good place, finding gratitude is not easy, but it could be something like, I'm glad I have a cup of coffee right now, or whatever it may be, right? And just keep it at 3 so that you can start small and it's not this big daunting task, right?
Well, yes, exactly. And I love what you said about meditation. Many people think that meditation means you have to sit quietly for 30 minutes possibly in an uncomfortable position, not scratch an itch, not have a thought in your head.
Yeah.
And that is impossible, at least for most of us. And so I thought, well, the remedy for that might be offering a very brief meditation. Anybody's got 3 minutes. Of course, over time, you may stretch it out to a longer period of time, as I do, but we can start with a 3-minute meditation, which is both brief and therefore suitable. I tell my trainees, if you're setting your alarm for 6, set it for 5:57. You're not going to notice the 3 minutes of less sleep. That will give you 3 minutes to do your morning gain practice.
I love
So
it.
it can be very short. And also, I'm going to give you things to actually think about. So we're not banishing all thoughts from our head. We're actually focusing on what I think are the 4 pillars of well-being. And I think through that, we can get started. And we learn in baby steps. So if we can start with a 3 or 4 minute practice every morning, we're beginning to rewire our brains. And we do things that feel good, and we recognize that we're moving in a positive direction. We can actually get in a place where we want to do more of that.
Yes.
And little by little, we rewire our brains. And it's not difficult. It just takes purpose.
Right. And it does take sometimes a little bit, like you said, changing your alarm for 3 minutes. It's reframing how we see things sometimes, right? Because people have their preconceived notions about a gratitude list or about meditation. But so let's review GAIN: gratitude, acceptance, intention, and what's the N?
The N is non-judgment. So, and I think these 4 pillars are very much, I'm mixing metaphors because they're pillars, but they're interwoven. So maybe they're the 4 threads
I like
that
that.
are interwoven to form this, very strong material that really can provide for our well-being. And we don't have to write it down if you're not a journaler, and I'm not actually. So just sit with the gratitude, and you don't have to write it down. There's nothing that we want to force about this process. So simply as we sit and get in touch with our breath and deepen and slow our breath, which will activate our parasympathetic nervous system, it turns down the sympathetic nervous system and lowers our heart rate and blood pressure, our cortisol, our adrenaline. So we get in touch with our breath, we slow it down, and then we go through 30 seconds of gratitude. What am I grateful for today? I'm grateful for my health. It may be relative, but I'm grateful for it. It's a miracle the way that our bodies work and generally work well. I'm grateful for my loving family and friends and community. So we all have much for which to be grateful. We move then to acceptance, and we may pick something painful. For me, I have a little shrine in my meditation room to my son that my sister made. It's a compilation of his photos and so on. And so I bring that pain closer and closer into my heart. I open my heart. I bring the pain in. I nurture it with my heart. I fully accept it. I relax my body. I relax into it. And if I ask myself the question, can I live with this forever? The answer is eventually yes. We move to intention. We may spend 10 seconds simply noticing what's happening right now, even physically, the pressure of the chair against our body, the sound we may hear with our eyes closed if we breathe deeply and slowly. And we move from the intention of the present moment to the general intention of being more positive.
I love it. Thank you so much for your time today, Dr. Hammer. I hope that you'll come back because I have so many more questions for you. We're out of time today. And I'm going to read your book. And thank you so much for being here, Dr. Greg Hammer, greghammermd.com. And we'll see you again soon, I hope, Dr. Greg. And everyone home, stick around for more America Trends.